Welcome to the Deep Dive, where we do the heavy lifting to keep you well informed.
Okay.
Today, we are cracking open a stack of sources on a topic most of us think we get: attention deficit hyperactivity disorder, ADHD. And for decades, it's been written off as just, kids being badly behaved or maybe a lack of effort. But the data we've been looking at, it just paints a totally different picture.
Yeah.
It's showing ADHD is this huge neurodevelopmental thing, and critically, it's having this massive silent economic impact on all of us. So our mission for this deep dive is to get past the classroom drama and really unpack the science. We're talking about how ADHD affects your brain's ability to manage itself. Attention, planning, impulse control, all the big stuff. Okay, let's get into it.
It's so important to focus on those things you just mentioned, the attention, the planning. We group them together under the term executive functions. Think of it like your brain's CEO. And if the CEO is struggling, the whole company struggles. And what's really fascinating here is just the sheer scale of the problem versus, the scale of the response. Global health estimates are pretty firm on this. About 5% of children have ADHD. And that old idea that you just kind of grow out of it, it's just not true.
Not at all.
Adult prevalence is still around 2.5 to 3% globally. That's millions and millions of people. But the diagnosis rates are just shockingly low, which creates this hidden toll, both human and economic, that we're going to dig into.
And it seems like the misunderstanding starts really early. I mean, the second a child walks into a classroom, you look at the standard guidance like from the NHS, and the classic struggles are all there. Can't sit still, trouble focusing, following directions, controlling impulses. But these are all neurological differences.
Yes.
And they're just constantly misread as a kid, being defiant or lazy.
Yeah. That misinterpretation is the core systemic failure. Because we call it defiance, the kid gets punished, not helped. And this isn't some small, localized thing. You look at the prevalence rates, and they are consistent everywhere.
Right.
Peer-reviewed studies in the Arab region, for example, show rates between 4 and 7%. In Saudi Arabia, it's 3.5 to 7% of school kids. These are not small numbers.
And we're sending these kids into school systems that are just not built for them.
Precisely. The system is just ill-equipped. I mean, you've got a lack of specialized teacher training, classrooms that aren't adapted, and referral pathways that are, frankly, a total mess. So what happens? A child who is genuinely struggling to self-regulate gets labeled, they get stereotyped, bullied, and that constant stress, that feeling of being misunderstood, it just erodes their confidence. It can reshape entire family dynamics because the support just isn't there.
And that failure early on just snowballs.
Yeah.
But this deep dive, it uncovered something that I found, honestly, kind of shocking. It shows just how complex diagnosis can be. This is where it gets really interesting. The overlap between ADHD symptoms and celiac disease.
This is such a critical point. It's a huge argument for holistic screening, not just, ticking boxes on a behavioral checklist. Undiagnosed celiac disease, it's a chronic immune condition.
Okay.
When you eat gluten, it causes inflammation. And that chronic inflammation can cause neurological symptoms that look almost exactly like behavioral instability.
So hang on, you're saying what looks like a focus problem could actually be an immune system problem.
Exactly. And it's well documented. WHO and NHS reports both detail this overlap. Unmanaged celiac can lead to crushing fatigue, mood swings, anxiety, irritability, and serious neurological issues.
Like what?
We're talking about brain fog. It's a real cognitive impairment and just a dramatically reduced ability to concentrate. Now imagine a student or an employee dealing with that every single day. They look disengaged, they're forgetful.
And the system just sees a performance issue. So they get disciplined for what is, at its root, a physiological condition. You're basically punishing someone for having an immune disorder.
That is the danger. If we only look at the behavior, at the conduct, without considering the physiological baseline, without screening for something like celiac, we can completely miss the root cause. It shows any diagnostic path that is purely behavioral is just too narrow.
And this problem follows people right into their careers, which brings us to this enormous adult diagnostic crisis. For years, the thinking was that ADHD just sort of faded away in your teens.
The old myth.
Yeah, but the research is solid. It persists in 3 to 4% of adults across the globe. And the UK is just a staggering example of this diagnostic gap. The estimates suggest about 2.5 million people in England fit the criteria for ADHD.
Yeah.
That includes 1.6 million adults over 25. But when researchers went through almost 10 million GP records, they found a formal diagnosis was on file for only 0.32% of adults. ADHD UK thinks over 80% of adults with the condition are undiagnosed. I mean, that's just a shocking number.
It's a colossal failure of both awareness and access. And that failure creates incredible struggles in the workplace. Adults with undiagnosed ADHD are often dealing with chronic disorganization. They find it impossible to prioritize. They have these sudden focus lapses. They can't manage time.
Missing deadlines.
Missing deadlines, forgetfulness.
Right.
And the problem, as the clinical guidance points out, is how management sees this. They don't see a neurological profile. They see a lack of commitment. They see laziness.
So not only are you struggling just to function, you're also being judged unfairly for it all the time.
Exactly. Imagine how exhausting that is. Working twice as hard just to keep your head above water, only to be constantly seen as someone who isn't trying. And you don't even know why it's happening, but, and this is a huge but, the research also shows this amazing paradox. Institutions like Harvard have highlighted this. When these same individuals are put in the right environment, one that plays to their strengths, they don't just cope. They excel.
Right.
They show incredible creativity, they're rapid problem solvers, they have a huge entrepreneurial drive, and they have this ability to hyperfocus, to just dive incredibly deep into something that interests them.
So the very same brain wiring that makes it hard to do a spreadsheet is what allows them to be these amazing innovators.
That's it exactly. When you channel that hyperfocus and accommodate the other challenges, these people become massive economic assets. But if you try to force them into a rigid box, they become a liability. And it creates this huge personal and economic drain.
And the human cost is so clear. But that brings us to the economic price tag. I mean, the figures in these sources are just staggering. The cost of this failure completely dwarfs the cost of actually fixing it.
The numbers are cold, but they make you pay attention. International studies estimate that untreated ADHD costs advanced economies around $19.4 billion a year, just for children.
Wow.
Another $13.8 billion for adolescents. But for adults, the cost just explodes. We're talking somewhere between $105 billion and $194 billion annually.
Let's just pause on that. $194 billion. That's about the entire GDP of a country like New Zealand or Kuwait, lost every single year.
And that's not a medical cost.
No, that capital being sucked out of the economy.
It's driven by lower productivity, higher unemployment, more sick days, and all the downstream costs. The mental health services people need for the depression and anxiety that comes from being unsupported for a lifetime. And if you bring it down to the individual level, the direct annual cost for one untreated adult in Europe can be over 12,000 euros.
Okay.
But that number jumps to over 20,000 euros. That's more than $21,000 when you add in lost income from being underemployed or losing jobs. Imagine what a family could do with an extra 20,000 euros a year.
And if you zoom out even further to the bigger public health picture, the scale becomes almost unthinkable.
It does. The World Health Organization estimates that untreated mental health disorders in general, which often stem from this exact kind of misdiagnosis, cost the global economy nearly $1 trillion in lost productivity every year.
$1 trillion.
And when our systems are failing to diagnose 80% of a specific neurodiverse population, we are actively contributing to that $1 trillion hole.
And even with these big public health systems, the sources show this incredible lag. The UK, for instance, now has some of the slowest adult assessment pathways in Europe. NHS waiting lists can be years long.
Yeah.
Years.
It's unbelievable.
But I found this one thing in the sources that was it was a fascinating contrast. It shows where the evidence can actually break through. While the health system is lagging on diagnosis, the British judicial system has actually moved faster.
That's a really profound point.
Right. Since a 2020 update to their Sentencing Council guidelines, ADHD can now be considered a mitigating factor in court. It's not a get-out-of-jail-free card, but
No, of course not.
a forensic psychiatrist can argue that the person's symptoms genuinely impacted their self-control or their decision-making during the offense.
Which raises a huge question.
It does. If the legal system, which is all about accountability, can recognize the neurobiology here, why is the health system, whose job is to provide care, so far behind on just delivering a timely diagnosis?
It proves the evidence is already there. It's actionable. The problem is translating that knowledge into policy. The path forward, based on all the modern research, is so clear. We need massive public awareness campaigns, we need ADHD-informed policies in schools and offices, and we need comprehensive diagnostic pathways.
And based on what we said earlier, that means more than just a questionnaire.
Absolutely. The assessment has to be holistic. You need the neurological and behavioral assessments, yes. But you also have to screen for physiological factors like celiac disease, especially if you see symptoms like chronic fatigue or that deep brain fog. We have to treat the right root cause.
So it's not really about managing a disability. It's about unlocking a huge amount of human potential.
It is an economic investment in human capital. And we have proof this works. Countries like Canada, Sweden, Australia. They've shown that when you invest early in teacher training, in support systems, in adapting workplaces, it's not a social cost. It is a long-term economic strategy. It boosts productivity and strengthens your entire society.
So what does this all mean for you, listening to this? Well, the struggle of someone with undiagnosed ADHD isn't just a personal problem. It is a national economic challenge that we are all, collectively, choosing to ignore.
The final takeaway really is that the evidence is just overwhelming at this point. These reforms, accessible diagnosis, individualized support, adaptive environments, they aren't luxuries. They are essential investments for economic stability and growth.
And maybe the most important insight from all these sources is about the cost of just doing nothing. Every single year, we wait for a coordinated national strategy, we deepen the economic loss, we widen the social gaps, and this is the real tragedy, we rob ourselves of brilliant, innovative minds that could be driving our future. That's a huge opportunity we're wasting, and a question worth thinking about on your own.